Welcome to UMCC Medical Consultant Connectors, where your health matters to us. In our modern world, we are constantly bombarded with information, yet truly understanding our own bodies can feel like a monumental task. That is why we are here to help break down complex medical topics into clear, understandable language. Before we delve into today's important subject, I encourage you to click like, subscribe, and the share buttons below. By doing so, you help us spread credible health knowledge to a wider community. Today we are focusing on a condition known as enterocolitis. While the name might sound technical, it describes a common and sometimes serious problem affecting the gut, and knowing the facts is the first step to protecting your health. Enterocolitis is essentially inflammation within your digestive tract, specifically the small intestine and the colon. Inflammation can disrupt nutrient absorption and waste elimination. It can range from mild, temporary discomfort to a life-threatening emergency. It is particularly dangerous for newborns and the elderly. So, what exactly is enterocolitis? Let us break down the term. Entero refers to the small intestine. Colitis refers to inflammation of the colon, the large intestine. Together, enterocolitis means both the small intestine and colon become inflamed, swollen, and irritated. This inflammation is your body's response to injury or attack and can impair gut function. The lining can be damaged, reducing absorption of water and nutrients, and sometimes causing bleeding. It can affect anyone at any stage of life, but risk is higher with underdeveloped or weakened immune systems. One of the most frequent culprits is infection. Clostridioids difficile, Salmonella, and certain strains of E. coli can release toxins that trigger inflammation. Viruses like norovirus are common causes, leading to stomach flu outbreaks. Microscopic parasites can be contracted through contaminated food or water. These germs disrupt the healthy gut environment. Recognizing the signs and symptoms of enterocolitis is critical for timely care. Symptoms can appear suddenly and intensely, or develop gradually over a few days. The most common indicators are digestive distress, persistent abdominal pain, from a dull ache to severe sharp cramps. Diarrhea is a hallmark, frequent, watery, and sometimes with mucus or blood, a red flag. Fever, nausea, and vomiting can lead to dehydration and feeling unwell. Other signs: significant loss of appetite, abdomen swollen, bloated, and tender. In infants, signs can be subtle: trouble feeding, unusual lethargy or floppiness, a swollen belly, or visible blood in stool. Medical emergencies include severe, unrelenting abdominal pain, high fever, significant blood in stool, or a hard, rigid abdomen. Go to the emergency room immediately. Doctors follow a systematic process. First, a thorough medical history, then a physical exam. They ask about symptoms, duration, severity, recent antibiotics, travel, hospitalization, or suspect foods. They listen to the abdomen, press gently for tenderness and swelling, and assess rigidity. Stool tests look for bacteria, viruses, parasites, or C. Difficile toxins. Blood tests check white cells, inflammation, and electrolytes. Imaging such as X-ray, ultrasound, or CT looks for blockages, thickening, or free air. Treatment depends on the underlying cause and the severity. For many mild cases, especially viral, supportive care lets the body heal, rest, and stay well hydrated. Diarrhea and vomiting deplete fluids and electrolytes. Water helps, but oral rehydration solutions are better. They replace lost salts and sugars. A bland diet may be recommended. Avoid spicy, fatty, and hard-to-digest foods for a few days. If bacteria are the cause, some infections resolve on their own, while others need targeted antibiotics. C. Difficile is treated with specific antibiotics. If antibiotics triggered the enterocolitis, your doctor may stop them and consider probiotics to restore gut balance. Always consult a professional first. Severe cases often require hospitalization for IV fluids and electrolytes, bowel rest, close monitoring, and pain management. This care prevents complications, especially for infants, the elderly, and immunocompromised patients. In critical cases, surgery is necessary when intestine has died from poor blood flow, or when the wall has perforated, causing life-threatening peritonitis. In infants with necrotizing enterocolitis, emergency surgery can be life-saving. Rapid diagnosis and intervention are essential. While doctors have effective treatments, the best approach is prevention. Practice good hand hygiene. Wash with soap and warm water for at least 20 seconds. Wash after using the restroom, before preparing or eating food, and after being in public places. Hand sanitizer helps, but is not effective against all germs, including C. difficile spores. Many cases come from foodborne illness. Cook meats, poultry, and eggs to safe temperatures. Wash fruits and vegetables. Use separate cutting boards for raw meats and produce. Refrigerate leftovers promptly and check expiration dates. When traveling, choose bottled water and well-cooked foods. Use antibiotics only when necessary and as prescribed. Do not request them for viral infections like the common cold. Antibiotics can cause resistance and disrupt gut flora. Hospitals rely on hand washing, glove use, and isolation for contagious infections like C. difficile. For newborns, breastfeeding helps protect against NEC,